Good afternoon, good morning, good night, depending on where you are connected from. Dear colleagues, today we will have two very expert and famous speakers presenting their view on the comprehensive ultrasound solutions for management of liver disease. This is an EFSUM webinar, which was promoted by GE. And I think this is a very timely topic because several innovations have come and have been all embedded in single equipments. So today, you will see we have many possibilities to be delivered to one single patient with one single equipment and one operator, not needing to request different assessment. And you might think this is not so relevant because you can send the patients to the right place. So my second point is that not only the technical solution have changed, but also our patients have changed a lot in the last 5 years. Up to about 5 years ago, to the arrival of direct antiviral agents for hepatitis C, it was very clear which patients had chronic liver diseases who deserved imaging investigations, and therefore they could be easily sent to committed centers, to centers exactly committed to the investigation of chronic liver disease, thus with specific expertise and with all the needed equipments, sometimes in different instrumentations. Today, thanks to the possibility to treat viral agents, we have fewer and fewer patients who are well aware of having a chronic liver disease and potentially advanced chronic liver disease. We are seeing many more patients with metabolic disease, namely with fatty liver, and also with a mixture of alcoholic and metabolic disease. This means that many patients come to our observation without having knowledge of suffering of chronic liver disease. And you maybe investigate them simply because they are diabetics, they have abdominal discomfort, but they are overweight, and potentially they drink several units of alcohol and they come for other complaints. In this situation, it is very important to be ready, not only to deliver the conventional abdominal ultrasound, but to interact with the patient, not only to be ultrasound operators, but to be clinicians, to understand the potential risk of advanced chronic liver disease, and therefore to be ready to investigate these patients with all the needed technologies. And these are very well known to clinicians. Therefore, it's a big pleasure for me to have two hepatologists here today. They are not ultrasound operators, they are not radiologists, not to mention that radiologists are not good, but they are used to manage patients, to put the right question, clinical questions, to understand the symptoms, and they are used to take the patient history, which is very important, and to also interpret the lab results, the platelet count, the abnormalities in liver enzymes. Therefore, when the patients come into the room for having one ultrasound investigation, receives a very comprehensive investigations and can exit the room with a clear diagnosis, clear assessment of their status, provided that they have been investigated by expert operators with top equipment, with not top equipments in terms of only high-end equipments, but with equipments which have the possibility to perform multiparametric assessment. This has become a need. Therefore, today we will have Professor Alina Popescu. She's a very expert professor of the University of Timisoara, working in a unit of gastroenterology, a long-standing friend of mine, as well as is Professor Annalisa Berzigotti, who has recently achieved the position of head of hepatology division at the University of Bern in Switzerland. Therefore, both of them are both clinicians and very expert ultrasound operators. And therefore, I'm very eager to listen at their talks. So I give the word and invite Professor Alina Popescu to turn on her camera, and she will deliver a talk on multiparametric ultrasound for the assessment of non-alcoholic fatty liver disease. Thanks, Alina.